Restylane with lidocaine in it. As you can see, that's what the L is for. In certain locations, you don't need any further anesthetic. In this case, because we're going to put a little bit inside the lip vermilion, or that little edge, we're going to add some local anesthetic as a dental block. A little sharp. May feel a little pressure now. If I hurt you, let me know, and I can go slower. It should be essentially painless. Okay, that's one. We do the same thing on the other side now. 1, 2, 3, a little sharp. Again, if I go too fast, slow me down. Okay. Now we're going to do the bottom lip as well. Come here, do the right side first. You can actually see the nerve here. It's very simple. A little pinprick, a little pressure. Okay. In a minute, you'll feel like your lips are very large, but I haven't injected anything yet. Same thing on this side. A little pinprick. Good. I know those can smart sometimes. You're doing very well. And that's it. We're going to inject the Restylane now. As you can see, it's clear. That's hyaluronic acid. We have ice on the lips to decrease swelling. Okay, Melissa, you can move that. They feel big and fat? Mm-hmm. Mm-hmm. Don't talk, you'll bite your lip. Now obviously you have beautiful lips, and all we really want to do is outline that little border and take care a little bit in the corner here, just to turn that angle up a little bit. Nothing obvious. If you feel anything, you stop me. Subtlety goes a long way here. That's all we're trying to accomplish. You'll notice that I don't inject anything in the center of the lower lip, specifically because we don't want one big sausage going across. And in the upper lip, we will inject a little bit in the center, but to create definition. Because the upper lip really is 3 pieces. The side and the center. Support for the corner. And I'm checking to make sure that I save half for the other side. Okay. So really it's all we're trying to accomplish. And it looks a little funny because the lips aren't sitting just right because of the local anesthetic. But on Thursday, you'll be able to see what it actually looks like in person. When somebody starts with nice full lips, the last thing in the world you want to do is create volume. So I'm using a very small amount of product and really think of it as a lip liner. Just to outline the lips. And again in the corner for support. Open. Good. That's really when you want to check for symmetry, you have them open their mouth, because now you can see where the injection is. Because once the local is in for the block, the muscles aren't working properly when it's closed. But open works just fine. Looks like you have an old scar here, the white patch.
Mm-hmm.
Yeah, that's okay. We don't have to do anything special for it. Again, we want to stay what we call paramedian here, off the midline, because we don't want one big sausage going across. Notice I didn't inject anything in the center. And on the top, really just enough to give a line. And I have a little bit left, so we'll give you a little bit more out here where I owe you some. And then last adjustments. Okay, go ahead and put the ice on a second. The nice thing about the Restylane is that it's a very moldable product. If you could take the ice off now. So I just take my fingers after they've been moistened with just a little bit of water, and I'm feeling for any lumps or anything that feels like there's too much in one spot or too little in another. And here you do have an opportunity to smooth things out. So the fear of having lumps and bumps really should not be realized, because you do have an opportunity to smooth it out. It feels rather smooth now, so I'm just emphasizing the natural contours. Okay, good. Go ahead and put the ice back on.